Hi everyone, Kitty here with Healing Restorations Ministries, Mind, Body, and Soul. I came across a gripping story that really caught my attention, which has been the case with so many stories surrounding the coronavirus pandemic. However, I felt the need to address this particular story to bring awareness to the importance of communicating with sedated and comatose patients. My hope is that this video would bring about improvements in patient outcomes, especially for sedated and comatose patients who are in the ICU on a ventilator and, like so many other patients right now, amidst concerns over the coronavirus, cannot have visitors. Now, what do I mean by sedated and comatose? Very briefly, sedated refers to a state of semi-consciousness, which can be medically induced, and comatose refers to a state of deep unconsciousness, which can also be medically induced, but can be caused by other factors such as brain trauma or severe illness. Now, the story that I'm referencing is a story about a young lady named Crystal Cadet. She's 34 years old. She's a FDNY Emergency Services paramedic. She was diagnosed with COVID-19 coronavirus about a week ago. The latest reports that I've read is that she is in the ICU on a ventilator. She does have asthma, which had been under control. Other than that, she had been healthy. In addition to just the sad nature of this story, what caught my attention was when Crystal's mother had said how difficult this was for her because her daughter is sedated and can't hear her. And that's why I wanted to do this video. Because there is evidence that sedated and comatose patients can and do hear. There was one research study. There are several research studies that you can find online, but there was one in particular that was out of Northwestern University and VA Hospital, by Dr. Teresa Pape and colleagues. And just briefly, I'll put a link to the video for this story, but they were looking at patients' brains who were in a coma. And they had a recording that the patients listened to via headphones 10 minutes a day, 4 times a day, 7 days a week. And what they noticed is that certain areas of the patient's brain actually lit up when they heard their loved ones telling these stories. That was evidence that there is a positive link between patients in the ICU or patients that are comatose hearing their loved ones' voices and positive outcomes. There are some other links that I put in the description box, but I want to tell you about my own personal encounter with a patient who was in a coma. When I was working as an ICU nurse, I took care of a patient, 76-year-old female, who was transferred from the nursing home because she'd stopped breathing and her heart had stopped. She was transferred to the ICU. She was on a ventilator. She was in a coma. She had no family. No visitors came to see her. I felt so bad for her, and I was so sad for her. I called my mother and asked her what to do, because my mom was the one that had more wisdom than anybody that I knew, and she never steered me wrong. My mom told me to pray for her, to get down to her ear, right where she could hear me really good, and to tell her that Jesus loved her, and so did I. She told me to tell her to fight, that I believed in her. My mom told me to give her hope, faith, and love. My mom told me to tell her that I was rooting for her, and that she was important, and she mattered, and that she could beat this. I did all those things that my mom told me to do, in addition to reading her scriptures. My mom told me to read her Psalms 23. The Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. He leadeth me beside the still waters. He restoreth my soul. He leadeth me in the paths of righteousness for his name's sake. Yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me. Thy rod and thy staff, they comfort me. Thou preparest a table before me in the presence of mine enemies. Thou anointest my head with oil. My cup runneth over. Surely goodness and mercy shall follow me all the days of my life, and I will dwell in the house of the Lord forever. Amen. I read that to her. My mom told me to touch her tenderly and with compassion, to fix her up. So I washed her hair in bed. I bought some pink ribbons and I fixed her hair in different styles, and I told her how pretty she looked. I spent a lot of time with her, and I just showed her that she mattered. I talked to her just like I did my other patients. When I went in, I didn't assume that she couldn't hear me, so that it wasn't important for me to introduce myself to her. I called her by name, Miss So-and-so, my name is Kitty. I'm going to be your nurse today. I'm going to take excellent care of you. Can you tell me your name and date of birth? Do you know where you are right now? I listened to her lungs, and I would tell her, take a deep breath, even though she didn't do it the last time. She couldn't do that the last time, but I didn't want to assume that here we go again, same old, same old. So I treated her like I would any other patient that I was doing an assessment on. I told her everything that I was doing and explained everything to her. Well, fast forwarding, while the doctors and nurses were literally waiting for her to die, because the doctors said that they had done everything that they could to save her, and that her condition had deteriorated so much until basically there was no way that she was going to pull through. It was just a matter of time. And when I say time, I mean a matter of hours even. So while everyone was standing around waiting for her to die, not literally standing around, but waiting for her to die, I witnessed a miracle. She came out of that coma. She came out of that coma. And what was really telling is that she said she heard us. She heard each and every one of us while she was in that coma. She told the nurses and the doctors that she heard them. She told them that she heard them standing around her bed, talking about her as if she were already dead. She remembered each hand that touched her. She remembered when they touched her roughly, when they touched her tenderly. And she said she remembered when I talked to her. She remembered when I got down in her ear and I told her that Jesus loved her and so did I. She remembered the scriptures. She remembered me telling her to fight. She remembered and said that I gave her strength. She came out of that coma and she was fine. She left out of that hospital and was transferred back to the nursing home. So what I want to say and leave with you is that patients, not all, but some patients that are sedated and in a coma, they hear us. They hear. And we don't know which ones can hear and which ones can't. So it's important, especially during this time when patients can't have visitors in the ICU and they're on a ventilator, it's important to still talk to them. Let them know they're important. Let them know they matter. I would say please to any nurse, doctor, healthcare provider that is watching this video, or anyone that's watching this video, to pass the word on. I know that patients can't have visitors right now, but is it possible that you could work out something with their family member, their loved one, to put the phone up to their ear just for a couple minutes, a few minutes, so that they can hear their loved ones say, I love you. I'm praying for you. You can make it. Tell them just a short little few words about, remember that last time when you had your birthday, how much fun we had? We're going to do that again. Is that possible? I know in that study that I mentioned, the patient had on headphones and listened to recordings. Maybe that's not possible. But a couple of minutes just for their loved ones to hear their voice on the phone, to put the phone up to their ear. And if you are the loved one of a patient that is in that situation right now, have that discussion with the nurse, with the doctor. Have that discussion with them to see if it's possible. I don't want to give false hope and say that every patient is going to have the same outcome that my patient had, but it's worth it. It's worth it to put the phone up to their ear, to work out something, headphones or something, where they can hear their loved ones' voices. It's worth it because they hear us. So until the next video is posted, I'm praying for each and every one of you. God bless you, and take care.